Well, hello and welcome back to Benefits TV. I am your host, Christine Blaisman, your licensed insurance agent serving small businesses and Medicare beneficiaries. Today, we're going to talk about Medicare Advantage versus Medicare Supplement. A lot of people who are turning age 65 or they are retiring from their employer and leaving their group coverage. That's one of the biggest questions that we get. What is the difference? I'm not going to do a deep dive on this today, but I will go over some of the high level differences. So probably the first and most significant difference between Medicare Supplement and Medicare Advantage is going to be your provider choice, your doctor choice. So in general, with Medicare Advantage plans, they all have a doctor network and a provider network that you do need to stay within. And especially if it's an HMO, there is not going to be any coverage outside of that network unless you're out of the service area and it is deemed an emergency. Now, PPO Medicare Advantage plans do have out-of-network coverage, but you will end up paying more. And in many scenarios, you do need to check. You need to dig a little bit when you're looking at a Medicare Advantage PPO, how the billing structure is going to work. Are you going to have to pay, if you use an out-of-network doctor, are you going to have to pay for that service upfront in full and then seek reimbursement from your carrier? Many of them are starting to operate that way, so it's definitely a consideration. Medicare supplements are different in that you can see any provider who accepts Medicare. And usually these plans work nationwide. So the doctor choice, your provider network is very large. So that's definitely something to consider. If you are looking at a Medicare Advantage plan and all your doctors and your preferred hospitals are in that network, that might work great for you. However, if they are not, and you want the freedom to be able to see any doctor in other areas as well, out of state coverage, then you might want to consider looking more closely at a Medicare supplement. So benefit structures. So this one's a little tricky to address at a high level, but I can just speak from what I have seen. The Medicare supplement plans, some of them tend to be more robust in certain areas on coverage, and Medicare Advantage plans, as a general rule, not speaking for every plan that's out there, but they do tend to have more copays, more co-insurance. One of the big differences I do see that's a significant benefit category you want to look at is on the skilled nursing side. Many of the Medicare Advantage plans have a copay from days 21 through 100 in a skilled nursing facility, as opposed to some of the richer, the higher level Medicare supplement plans may cover that in full, all the way up to 100 days. So if that is an important benefit to you, you definitely want to look at that and see how they compare. I have seen some Medicare Advantage plans that do cover the skilled nursing facility copay under original Medicare, but sometimes you have to dig through several plans to find that. But in general, the lower priced Medicare Advantage plans do tend to have a higher copay for those skilled nursing days. So premium pricing, you're going to want to look at that. Many Medicare Advantage plans are very low priced, which make them very affordable. Some of the ones that are more expensive, in most cases, they have richer benefits. Medicare supplement plans, as a comparison, some of the higher level ones do tend to be a little bit more expensive, but part of what you are paying for are richer benefits and more doctor choice. So plan history, this is another important consideration when looking at a Medicare Advantage plan. It's really good. I always recommend you work with a local agent who has been doing this for a while, because they will be able to tell you what the history of that plan and that carrier is. How many years have they been around? Has this carrier introduced plans into the marketplace and then pulled them after a year? That can be very disruptive for someone who gets established on a plan. They like their doctors only to have it rescinded by CMS a year later. So from what I have seen in my 15 years of doing this, the Medicare supplement plans tend to be very stable. We've seen pretty minimal changes, other than, of course, we have plan premium changes And sometimes legislation does come into effect that could affect some of the benefit structures, but overall, they've been very stable. Whereas Medicare Advantage plans, in years past, certain carriers have been a little bit more volatile. And so it's something to, and some carriers are very stable with their Medicare Advantage plans. They've been around as long as the Medicare Supplement plans. So it's really beneficial to talk to someone who has seen the history of how the plans have operated. So Part D coverage, prescription coverage is definitely a really important consideration. With if you're considering a Medicare Advantage plan, you want to find out how does the drug coverage on that Medicare Advantage plan compare to a separate standalone Part D plan, which is what most people enroll in when they choose a Medicare supplement. How do those compare? How are your medications covered under those two different plans? So that could definitely be an important factor. Some added benefits, many times, actually both Medicare Supplement and Medicare Advantage will add extra benefits, like maybe they have a free gym membership, they might have discount dental and vision. Medicare Advantage plans often they run commercials talking about free dental and vision. And the other thing too is you want to do a deeper dive on who are your provider choices with that free dental and vision. Definitely something to check out. Lastly, I'm going to talk about enrollment timeframes and rules. So Medicare Advantage plans, people will have an initial enrollment window when they first turn age 65, and or if they are new to Medicare Part B, and or if they are leaving employer group coverage as well. They have an opportunity to enroll in Medicare Advantage or Medicare Supplement and a Part D plan. Now, I want to talk about the open enrollment period that happens every year from October 15th through December 7th. That's when we see all the commercials and we hear all the radio ads, and you get a lot of mail in your mailbox talking about the new plans and maybe plan changes for the new year. That is all for Medicare Advantage. That time period, October through December, that is the Medicare Advantage and prescription drug open enrollment period. It's also known as the annual election period. And that is when people who are either new to Medicare or they've been on a Medicare Advantage plan, they can change to a new one. And the same for the Part D plans. Many people think, though, that this open enrollment period applies to Medicare supplement plans, and it does not, actually. Can you apply for a Medicare supplement plan during open enrollment? Yes, you can. However, you do not, if you're not in your initial enrollment window, like turning age 65, coming off of employer group coverage, and or new to Part B, then it's very likely you are going to have to answer medical questions and go through medical underwriting. And so that is definitely something to consider. So in a nutshell, Medicare Advantage plans are very easy to come on and off of. And during that time frame of October 15th through December 7th, you will receive what's called guaranteed issue. That means that there's no medical questions asked. They will not rate your policy up, increase the price, or deny you. Guaranteed acceptance, and the new plan effective date will go January 1st. And so that is a time when you want to evaluate your plan options and choose to either stay where you are if you're in a Medicare Advantage plan, or perhaps consider a new one. Now, with Medicare supplement plans, it is important when you first become eligible to really get the education that you need to make the best decision for your healthcare needs. Because once that open enrollment window passes for Medicare supplement, it could be more difficult to enroll later on. So in a nutshell, very easy to move later from Medicare supplement to Medicare Advantage, because you can just move during the open enrollment period in October through December each year. However, it may be more difficult to go the other way from Medicare Advantage to Medicare supplement, just because unless you have and in fact, I think that one of the other enrollment exceptions is if a Medicare Advantage plan is being canceled. I'd have to double check on that, but I have heard that before. Or if there's more than a 5% increase in costs or reduction benefits on the Medicare Advantage plan. So That was a lot, guys. I hope it was helpful. If you have additional questions, you can reach me at my email, Christine at storehouse.ins.com. So that's CHRISTINE at storehouse.ins.com, STOREHOUSEINS.com. Thanks. Hope this was helpful, and we'll talk to you soon. Bye.